The experience of pain is universal. Pain is defined as an unpleasant sensory or emotional experience associated with actual or potential tissue damage. Pain is an individual experience, and a core tenet in medicine, any branch of medicine, is that the patient's pain is whatever they say it is. It's whatever intensity they say it is, it's whatever location they say it exists. It is there when they say it is there, it is not there when they say it is not there. The perception of pain is influenced by physical factors such as numerous injuries, multiple pain stimuli, psychologic factors like depression or PTSD, and cultural factors that influence the perception of pain and attitudes toward pain. Nociceptors are the nerve endings that begin the pain impulse in the nervous system. Nociception is the process by which the nervous system sends the impulses and processes the pain for the individual. The pain threshold is the amount of stimulus that is needed to start this process of nociception. It is not how much pain an individual can handle, but it is literally the stimulus that begins the process of nociception. Pain facilitators are things that heighten the sensation of pain or strengthen that sensation or even begin the sensation of pain. These can be histamines, bradykinins, and prostaglandins, which are all inflammatory mediators of one kind or another. But generally, we can think of inflammatory mediators as being the sorts of signals that cause or heighten the pain sensation. These are pain facilitators. Pain inhibitors are things in the body that slow, deaden, or inhibit the sensation of pain. We have opioid receptors, GABA receptors, serotonin, the neurotransmitter, and another neurotransmitter, norepinephrine. All of these lessen or inhibit the sensations of pain or nociception. We can define different types of pain. Somatic pain is pain felt by the muscles or bones in our body. This is the sort of pain we normally feel. Visceral pain is gut pain, stomach pain, small intestinal pain, pancreatic pain, liver pain. It's pain generally felt by our internal organs. Referred pain is pain that is a signal that originates from another part of the body. A classic example is during a heart attack, a myocardial infarction, someone might complain of neck pain or left shoulder pain or back pain. This is classic referred pain because the site of injury is actually in the heart during a myocardial infarction. Neuropathic pain is a pain impulse that's sent up a nerve, but there's no actual physical damage going on. This is a dysfunction of the nerve itself and does not represent any tissue damage. Generally, we will divide pain into acute or chronic pain. Acute pain is short-term pain due to an injury or an event, and generally the expectation is acute pain will resolve until the individual is no longer in that type of pain. This is the sort of pain response you could expect with doubling over in pain or tears or screams of pain. In the most extreme example, acute pain is what we immediately think of when someone says their pain level is an 8 out of 10 or a 10 out of 10. Chronic pain, however, is very different. Generally speaking, chronic pain is pain that has existed in the individual for longer than 6 months. The body changes how it handles this sort of pain, and this pain is still very real, although the person may not show a lot of outward signs of pain. Maybe hesitancy with movement, maybe slowed movements, but generally speaking, they may rate their pain a 7 out of 10 or 8 out of 10, but not be writhing on the floor in pain. This represents a actual change in signal transmission in the body and can have really significant impacts on psychologic health as well. Acute pain and chronic pain present differently. Generally speaking, we will treat the patient's pain as they say it exists and advocate for better pain control for our patients where we can.